So I went to Michigan State University, both for undergrad and medical school. I studied human biology in undergrad. I spent 2 years' time after undergrad actually doing some orthopedic research in the Boston area before going back to Michigan State for medical school, which I graduated in 2013. From there, I went on to the Harvard Combined Orthopedic Surgery program in Boston, which I graduated from in 2018. And then from there, I went on to do a fellowship in orthopedic sports medicine with the legendary James Andrews down at the Andrews Institute down in Pensacola, Florida, which I graduated from in 2019. Like many orthopedists, grew up playing sports, had my fair share of injuries. I guess one of my more unique injuries is I had a unicameral bone cyst, which is a benign cyst in my proximal humerus, and playing contact sports growing up as my primary, interest, ended up breaking my humerus 5 times. Had multiple surgeries on it. Never had an issue since. So I think I knew my orthopedist better than my pediatrician growing up. I think it's probably part of it. And then secondary, orthopedics gives you very tangible outcomes. You can see something, you can fix it, and a lot of times these people are going to do well rather than chronically treating something. And I mean that you absolutely need people to do that as well, but I think the tangible nature of orthopedics and the ability to work with your hands as much as you do really makes it attractive. So being a sports medicine doctor, I think some people don't know ultimately what that means. It does not mean that you have to be a high-level athlete or you're in competitive athletics. You could be somebody that plays tennis once a year. You could be somebody that likes to go on walks around the block. Ultimately, if you are having pain and it's keeping you from doing the activities that you like to do on a day-to-day basis, that's what we're here for. A sports medicine doctor treats a variety of different ailments, ultimately trying to keep people active, keep people out of pain from knees, elbows, shoulders. Rotator cuffs are one of the big issues. People with shoulder instability, people with meniscal tears, cartilage injury, ligament tears, epicondylitis of the elbow. If you're a pitcher and you tear your ulnar collateral ligament, these are all things that a sports doc would have an expertise in and really focus on, ultimately getting you back to ideally the level you were at prior to injury or better, and keeping you healthy, keeping you moving, keeping you doing what you love to do. I think ultimately the most important thing is that the patient has a good relationship with their surgeon and with their doctor. If you can't make somebody feel comfortable or they just don't feel comfortable with you, then at the end of the day, that it's not going to be the outcome that you want. I think ultimately putting the patient first, listening to them, giving them their time, and respecting their time as well, that they came to see you and they got important things to do as well, and ultimately formulating a plan with the patient and giving them the input and making sure they understand, all the aspects of what you're recommending to them and why you're recommending them. And really making sure that they feel empowered in the decision making is really important to me. And I think that's ultimately how to keep how to really have a budding physician-patient relationship. I'll see anything, a variety of sports injuries, really anything, aches and pains that you want to come in and see me for. I'm happy to give you my expert opinion on. And if I feel that I have another provider within my practice who are better suited for whatever you may need, I will certainly make sure you get there as well, so that it's not just, you're sent off without a plan. I'll make sure that you have a plan. And ultimately, I know there's a lot of fancy things people see on TV that hear about from, biologics and stem cells and this and that and on down. Certainly, I'm happy to discuss anything that a patient wants to come and approach me with, but ultimately, I'll give my honest opinion about the data and kind of whether or not it's the right treatment indication. I'm not here to just sell you the latest and greatest. I ultimately want to make sure we have data-driven care and that it's ultimately going to get you the best outcomes possible.